Hello, my name is Kristin Amato. I am doing my psychology narrated presentation for the third time, and today I will be discussing the important aspects of the multicultural, social labeling, and family dysfunction explanations for the development of schizophrenia. Now, before I get into all of those explanations, I would like to discuss what schizophrenia is. Schizophrenia is a chronic and severe mental disorder that affects how a person thinks, how a person behaves, and how a person feels. People with schizophrenia may seem like they're not all there and they've lost touch with reality. Even though schizophrenia is not as common as other mental disorders, the symptoms can be very disabling. Now, some signs and symptoms of schizophrenia would be hallucinations, delusions, and the problem with symptoms of schizophrenia, they fall into three categories. So they could be positive, negative, and cognitive. Normally, symptoms of schizophrenia start between age 16 to age 30. In rare cases, children have schizophrenia too, but it's not very common. Some positive symptoms that I've already discussed were hallucinations, delusions. There are thought disorders that are unusual or dysfunctional, and there are movement disorders such as agitated body movements. Now, positive symptoms are psychotic behaviors that aren't generally seen in healthy people. As I said before, they do have a sense of losing touch with most aspects of reality. Moving on to the negative symptoms of schizophrenia, they are associated with disruptions to normal emotions and behaviors. There is a concept called the flat effect. It's when a person has a reduced expression of different emotions through facial expressions or their tone of voice. A person that has schizophrenia may have negative symptoms such as reduced feelings of pleasure in everyday life and completing everyday activities. They might have difficulty beginning and sustaining different activities, and they will have a reduced concept in speaking. Now, for the cognitive symptoms, there are some patients that can have these symptoms that are very subtle, but for others, they are more severe and patients may notice changes in their memory or different aspects of thinking. Some of those cognitive symptoms are poor executive functioning and the ability to understand different information and the ability to use that for making different decisions. Some people may have trouble focusing or paying attention, as well as problems with working and their memory. It's a lack of the ability to use information immediately after learning it. Now that I've discussed a little bit about what schizophrenia is, both positive and negative symptoms, as well as cognitive symptoms, I will go on to discuss the multicultural explanations for schizophrenia. Now, the multicultural factors, the rates of the disorder do differ between racial and ethnic groups. There was a statistic that states as many as 2.1% of African Americans are diagnosed, as compared to Caucasians that are only 1.4%. There has been a study that there is a possibility to explain this finding that African Americans are more prone to develop schizophrenia, yet another explanation may lie in the economic sphere. Now, African Americans are more likely to be poor, and when economic differences are controlled for, rates of schizophrenia become closer. Now, there is consistency with the economic explanation. Hispanic Americans who are also on average economically disadvantaged, they do appear to have a much higher likelihood of being diagnosed than Caucasians. Now, moving on, the rates do, differ between countries, as do the course and the outcome of the disorder. Some theorists believe the differences partly reflect genetic differences from population to another population. Others do argue that the psychosocial environments of developing countries tend to be more supportive than developed countries. This eventually leads to more favorable outcomes for people with schizophrenia. Now, moving on to social labeling. It is known as the labeling theory. Now, many social cultural theorists believe that the features of schizophrenia are influenced by the diagnosis itself. So it is kind of like its own problem. Social labels people who fail to conform to certain norms of behavior, and once assigned, the label becomes a self-fulfilling prophecy. Now, the dangers of social labeling have been well demonstrated. Now, when it comes to social labeling, there are some problems and difficulties when it comes to it. I want to say it's a learned social role. Schizophrenia, it's not a disease, it's more of a learned social role. Now, it is a label that's applied to ordinary people who have been caught breaking the residual rules of society. Now, those residual rules, they're not written down, they're not taught, they're not genetic. They're just rules about what we do and do not do in a variety of different situations. For example, talk to people, not objects, talk only to people who are there, respond to what they say, not to something else. There's just different rules that people follow. Now, some problems with the labeling theory is that there is a little bit of evidence that's unusual with the behaviors, and they're not given a label, but they do go away by themselves. Now, there is a little bit of reject in the genetic and neurological evidence, but those are just a few of the problems that the labeling theory or social labeling does come in contact with. Now, moving on to the last explanation I will discuss is family dysfunction explanation related to schizophrenia. Now, this is one of the best known family theories of schizophrenia that focuses on the double-bind communication. Now, some parents repeatedly communicate pairs of mutually contradictory messages that place the child in the so-called double-bind situations where the child can't avoid displeasing the parents because nothing the child does is right. Now, in the theory, the symptoms of schizophrenia represent the child's attempt to deal with these certain double binds. Now, the double bind messages basically consist of a primary verbal communication and an accompanying contradictory non-verbal meta-communication. Normally, according to the double bind theory, a child would repeatedly be exposed to these communications and will adopt a special strategy for coping with them. And eventually it may progress toward paranoid schizophrenia. This theory is closely related to psychodynamic notion of a schizophrenogenic mother. It has been more unsupported by research, but it's also popular in most clinical practices. Now, there have been a number of studies that suggest schizophrenia is also linked to family stress. There are studies that show parents of people with this disorder often display more conflict. They have greater difficulty communicating and are more critical of, or say over-involved with their children than other parents. Now, family theorists have long recognized that some families are high in expressed emotion and family members frequently express criticism and hostility and intrude on each other's privacy. Now, individuals who are trying to recover from schizophrenia are almost 4 times more likely to relapse if they live with such a family. Now, I have discussed the 3 explanations that were stated in the assignment. I have discussed the multicultural, social labeling, and family dysfunction explanations for the development of schizophrenia. And I hope you enjoyed my presentation, and I hope my visuals were a little bit better than my past presentations. I appreciate it, and thank you.